Hey everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today I am excited to have two guests joining me about a topic that we've received a lot of outreach on over the years, a lot of questions around, and I think it's a topic we've been looking forward to discussing on this program because we think it's a question-rich environment for all you folks out there who may have questions about different weight loss options available to folks. And my guests will start on my far right stage, I guess left if you're looking at it from your perspective point, is Dr. Ashish Padnani. He is the Medical Director of Bariatric Surgery at Morristown Medical Center. And between the two of us is Dr. Mohammed Feteiha. He is the Chairman of the Department of Surgery and President of the Medical Staff at Overlook Medical Center, both hospitals that are part of Atlantic Health System. Gentlemen, thanks so much for joining me today.
Thank you for having me.
Thank you for having us.
All right, folks, if you are new to Community Conversations, here's how this works. The doctors and I are going to chat about our topic of the day, but really this is sort of a three-way conversation. So if you hear something you want a little more clarity on, please feel free to add a comment into the chat box on your screen there. You can ask a question, you can ask for some clarity around something, introduce a relevant but maybe perhaps different topic than what we're discussing at the moment, and we'll try to get to as many of those as we can. Please keep in mind, all specific medical questions for your personal situation are probably best left directed to your personal physician, but feel free to ask them and we'll try to get to things in the best way we possibly can. If for whatever reason you maybe have to leave the room or close the browser window or whatever it may be, all of our community conversations live on our website, atlantichealth.org. You can subscribe to our YouTube channel where you're watching this episode. I'm proud to say we are now live streaming on YouTube, so be sure to subscribe and you'll never miss one of our episodes. Doctors, it is a terrible thing for people to miss our episodes. I encourage folks not to. So with that, let's jump into it and get going.
Sure.
All right. What I would like to start first with, if possible, take a real 30,000-foot perspective. When perhaps you first speak with potential patients, when you know there are patients who are considering perhaps surgical options as their best bet for weight loss, what are the kinds of things you hear from patients? What are they thinking about? What's their considerations? Maybe issues in their personal lives. Dr. Feteiha, why don't we start with you? What are some of the things you hear often from people?
Usually by the time I see a patient in the office for weight loss surgery, they know they've been struggling with weight for a long time. They've been on multiple diets, they've lost weight, gained weight, and gone through that yo-yo several times over. It really clicks for them when they are all of a sudden diagnosed with another medical problem, such as high blood pressure, diabetes, sleep apnea, and now they get the sense their health is in jeopardy. So now that's their call to action. That's when they've decided to really pursue weight loss surgery as an option to lose weight.
Dr. Padnani, do they often come with a preconceived idea of what they think they should do? How informed are folks when they get to you, or is it very baseline?
I find that the decision for weight loss surgery when the patients come in to see us, it's a very personalized decision. And different people come in for different reasons. Some people come in because they've been advised by their medical doctor that they've been going up on their medications for diabetes. Say, oh, you're on 3 medications for diabetes, it's time for you to consider weight loss surgery. There are others who are just struggling with basic stuff like day-to-day issues, walking around the block. They're having so much joint issues because of the weight that they're not able to play with their grandkids or bend down, tie shoelaces. So it's a very personalized decision for different patients. So most patients do have an idea or have a goal in mind that this is why I'm here. I am here to sort of talk about bariatric surgery because I want to get rid of my diabetes, or I don't want to take as many medications for blood pressure or cholesterol. And there are others, as I said, I want to be able to play with my grandkids, or I want to be able to live long enough to see my grandkids. Sure. So
it's all different kinds.
It's all different kinds.
And when they do first arrive in your office, or when these conversations more formally do begin, how transformative can it be when you say to them, here are sort of the options available to you and here's what we think we might be able to do for you over time? How capable is weight loss surgery of helping them reach those goals? And Dr. Padnani, why don't we start with you and then we'll come back to you, Dr. Feteiha.
So again, a lot depends on your individual medical condition. Weight loss surgery is indicated for people whose BMI is 35 or above. More specifically, if their BMI is 40 or above, they qualify for surgery. For people between 35 and 40, they have to have a comorbid condition such as high blood pressure, sleep apnea, cholesterol, diabetes in order for them to qualify. So when they come into our office and they have certain goals in mind, if they fit these criteria, they benefit tremendously.
So it's not one size fits all. It may depend.
That's correct.
And
that's
what
correct.
is BMI again? That's body mass index.
So BMI is body mass index. It's a value that's calculated based on your height and weight. If you want to know your BMI, you can go to our website, atlantichealth.org/bariatrics. There's a BMI calculator. You put your height and weight, and that shows up your BMI. If your BMI is 35 or above, you might qualify for bariatric surgery.
Dr. Feteiha, in terms of your experiences, how do patients tend to react when you articulate to them what the future may hold, if they're appropriate for this surgery, if it does work? Is there a sort of I guess a feeling of cautious optimism? Do they tend to say, "Wow, I didn't realize my life could transform this much through this process"? What do you see from
the first visit is a combination of excitement and nerves.
Okay.
And nervousness.
Sure.
So patients are a little bit nervous that first visit, even though we don't do any surgery in our office, and they're excited to hear about the prospects of the future. During that first visit, we really talk about the things that they're going to have to invest in, whether changing their eating habits, physical activity habits, leaving some of those older bad habits in the past, and forging a new way forward. They all want the surgery right away, but the process does take a little bit of time, usually around 4 to 6 months, to work through all of the preoperative workup and getting insurance approvals. But they are very excited when they walk out of the door, and they're ready to get going.
Very cool. As we mentioned, while the doctors and I are chatting, I encourage folks, if they have questions or comments about the topic we're discussing today, to please go ahead and put those into the chat field on your screen. We have one question here. Somebody has said they're type 1 diabetic, and they're having a really hard time losing weight. I mean, I would imagine that's something you hear frequently from folks who reach out to you. They have a thyroid condition that's currently under control with medications. And I guess the question really is, because they feel sort of stumped, like there's sort of no clear path forward for them. And I guess the question then being, would weight loss surgery perhaps be an option for them? And I'm sorry, I don't have this person's name here right in front of me, but I guess the question for you doctors would be, what would you recommend that person do? Talk to their physician, make an appointment to see one of you guys? What's a natural next step for a person who has that kind of situation?
Weight loss surgery will help with the weight loss, but it won't really help with type 1 diabetes. Okay. It does improve type 2 diabetes, but not type 1 diabetes.
Okay.
That's a situation where we would work closely with their endocrinologist to help create a plan both preoperatively and postoperatively for them to ensure success.
Folks, keep them coming. We're going to get to as many as we can. Dr. Padnani, let's tuck into the different types of surgeries. Is it the same surgical procedure for every patient? Are there major differences? What can our folks take away from this?
So just like most things in medicine, there's no one size fits all. Okay. Most of the surgeries that we do in Atlantic Health System, they're minimally invasive fashion, either done laparoscopic or they're done robotic fashion. The most common bariatric procedure that we do in the United States is called laparoscopic sleeve gastrectomy or sleeve gastrectomy.
Okay.
This surgery involves removing approximately 80% of your stomach, and we reduce the size of stomach from about 50 ounces down to about 3 to 4 ounces. So that reduces the capacity of the stomach and patients' ability to eat too much food at a time, helping them with portion control, which helps them with weight loss. Now, the portion of the stomach we remove is also responsible for producing hunger hormone called ghrelin. When we remove hunger hormone producing part of the stomach out, patients don't feel as hungry despite eating fewer calories, which helps them with weight loss. But one of the other very important reasons patients are able to lose weight is most patients with obesity, once their BMI crosses 35 or 40, develop enough insulin resistance where it's very difficult for these patients to be able to lose weight and keep that weight off until the hormones inside the body are changed. After the surgery, the gastric sleeve surgery, these hormones change to improve or resolve insulin resistance. These are the same hormones that are also implicated in improvement or resolution of diabetes, because the causation of obesity and diabetes goes hand in hand. And that's why we see resolution of comorbid conditions such as diabetes because of those same hormones that also helps with weight loss. So gastric sleeve is the most common procedure we perform. Gastric bypass surgery is the second most commonly performed operation. And then there are other operations such as duodenal switch, modified duodenal switch. There's a newer procedure that's been approved by American Society of Metabolic and Bariatric Surgery called mini gastric bypass that's been approved, although the insurances still consider that as an experimental procedure. There are some endoscopic techniques available. These are
endoscopic, again, for our audience who may not know what that is.
So endoscopic is where the surgery is performed without any incisions. It's performed by an endoscope, which is put in from the mouth through the mouth. Okay. But these are purely investigational procedures, and we don't have long-term outcomes on that.
I think the important, really, thing that one of the major takeaways there is that it's not, like you said at the beginning, it's not necessarily one size fits all.
Correct.
So for folks who have said, well, I know somebody who had a procedure like this, and maybe they're not comfortable with it, or maybe they're not sure that's the right for them, there are other options. There are also non-surgical options as well. Are you willing to shed a little light on what those may be as well? Dr. Feteiha, do you want to take a step with that?
Some of the non-surgical options other than just diet and exercise are some of these new diabetic medications that we see commercials for, like Ozempic, Wegovy, Rybelsus, that actually help with this insulin resistance and allow people to lose weight on their own. That weight loss is not as much as you see in weight loss surgery, but it does for the lower body mass index patients or patients who only need to lose 30, 40, 50 pounds. That may be a good option. A lot of our local endocrinologists and primary cares are really utilizing that medication, especially in type 2 diabetics.
You mentioned 30, 40, 50 pounds. How much weight can a person who maybe is losing 100 pounds possibly with a surgical procedure? What's the range of benefit folks can
on average, after a surgical weight loss, it's about 80 to 100 pounds.
Wow.
Yeah.
What are the real life implications for a person who loses that much weight? How transformative can it be for a person's health? To either one who want to take a stab at it.
It's night and day. You know, all of a sudden their joints don't hurt. They can walk up a flight of stairs without being out of breath. Some of the little victories that they have are, you know, like Dr. Padnani said, they could get on the ground and play with their children, or they could sit in an airplane seat and not need a seatbelt extension.
Right.
And all of a sudden they feel like they have so much more room. So there are big health victories, and then the little incremental victories that they come in and share with you that, you know, that make your day.
Yeah, I was going to say, that's got to feel wonderful to see that those folks literally undergo a transformation like that. How's that? How do you enjoy that when you see that?
This just recently reminds me of a very, very recent experience. Just last week, I had a patient who sent me pictures of her with her kids. She was not able to go to Disney, not able to have a good time with her family. She's lost over 100 pounds throughout this process. She's over a year out now and has lost over 100 pounds. She sent pictures from Disney, and she was so thankful that now finally she's able to do all of this that she was not able to prior to, you know, losing weight.
That's incredible. Okay, so we've established sort of your timeline of how folks may realize that this might be an option for them, the different options that are available to them. In terms of the process of how this goes, how long is a person in the hospital if they have the standard gastric sleeve process? How long does it take?
So typically it's an overnight stay at the hospital. So most patients will come in the morning of surgery. They do their registration. At Morristown Medical Center, we have our anesthesia colleagues who will do a nerve block prior to going into surgery. The nerve block helps a lot with pain control, and they require less pain medication after surgery. The surgery part itself typically takes about 45 minutes or so. plus anesthesia time. After surgery, they're up and walking right after surgery. Once they're awake enough, they start drinking clear liquids. And typically, the day after surgery, you know, if their vital signs are good, some of us will check some blood work depending on the patients. And you know, if that looks good, they're able to go home the day after surgery.
And then what happens? What's their recovery process like once they're home? How easy do they have to take it? How soon does life move back into their normal routine?
It's a very quick recovery. Usually within a week or two, they're back at work.
Wow.
And within 3-4 weeks, back in the gym, doing physical activity. So I always describe it to patients that the surgery is like a wedding date. So we spend a lot of time before surgery getting them mentally prepared, getting them medically prepared, and then the surgery is really just one day. And then we spend a lot of our time afterwards helping them navigate this.
Adjust to married life.
Adjust to married life, having them navigate their new life and their new stomach and how their body works.
What's that? What goes into that? I mean, are we talking dietary changes? Are we talking, you know, do you have to eat at certain times of day? What are some of the implications for folks who have this procedure?
So, you know, we often stress our patients, you know, before and after surgery that lifestyle changes are extremely important. Surgery is not a magic pill. It's not going to cure everything. You're going to have to put in efforts yourself as well. So you're going to have to change your lifestyle. You have to be committed to be able to eating healthy and be able to exercise on a regular basis in order for you to have sustained weight loss and successful weight loss journey. Our dietitians do an excellent job going through what to expect in terms of diet, both before and after surgery. And again, depending on the surgeon, I think most of us will have patients on a liquid diet after surgery for a certain period of time. If they're doing okay with the liquid diet, they progress to a pureed diet followed by a soft diet and then a regular diet. But we work very closely with our dietitians who do a very good job helping our patients through this journey.
Wow. Folks, we've covered a lot of ground today. As we sort of come down the end here, I want to just sort of hit again some of the high notes for folks who may have joined us a little late in the program. So to reiterate, and we can do this kind of like a more abbreviated version, this type of, there are many types of weight loss surgical procedures for folks. Best place to start, again, would be with their personal physician?
Talking to your personal physician, get a referral for a bariatric surgeon, and depending on your individual medical history, I think that it's a decision between you and your surgeon as to what you're trying to achieve with what particular procedure you're planning. So I think it's a personalized decision. It's not a one size fits all. It's a decision between you and your bariatric surgeon.
And Dr. Feteiha, for folks who may be saying, yeah, I've heard all this, but does this stuff really work? Can this really make a difference? We're talking about transformational, life-changing procedures here.
Right, exactly. And the important thing, even though there are multiple surgical options, a lot of the surgical options that we employ, they affect your metabolism. So it's not just a matter of eating less and exercise. It's boosting your metabolism to help with your weight loss, change your hormonal makeup in terms of improving things like inflammation, sleep apnea, and diabetes. So it's much more than just eating less and exercising. This really does provide a boost to improve your health.
All in the spirit of making someone of a new you. So folks, I hope you enjoyed everything we talked about today. I'd like to thank our guests on today's Community Conversations, Dr. Ashish Padnani, who is the Medical Director of the Bariatric Surgery Program at Morristown Medical Center, and Dr. Mohammed Feteiha, who is the Chairman of the Department of Surgery and the President of the Medical Staff at Overlook Medical Center. Again, my name is Luke Margolis. I'm the Corporate Comms Director at Atlantic Health. If you missed any part of today's Community Conversation, subscribe to our YouTube channel. Please, you will thank me for it later on, where you can stay on top of all of our great content, including conversations like the one we just had. Thanks so much for tuning in today, folks, and we will see you next time.